What if the organ working hardest to keep you alive right now is also the one you check on the least? Somewhere inside your body, two fist-sized organs are filtering your blood at this very second, removing waste, balancing your fluids, controlling your blood pressure, and quietly keeping poison out of your bloodstream. And here is the unsettling part. They can lose up to 90% of their function before you ever feel a single symptom. Doctors call the kidneys the silent organ for a reason. Unlike your heart, which announces distress with chest pain, or your stomach, which screams with cramps, your kidneys suffer in silence. They fail quietly, gradually, almost politely, until one day, the damage is no longer something a pill or a diet change can fix. By the time most people notice something is wrong, they are already in the later stages of kidney disease. And the frightening truth is this: millions of people are walking around right now with damaged kidneys, and they have absolutely no idea. Today, we are going to uncover 7 warning signs your body may already be sending you. Some of them seem so small, so ordinary, that most people brush them off as tiredness, aging, or stress. But together, they can form a pattern your kidneys are desperately trying to show you. Stay with me until the end, because warning sign number 6 is the one most doctors say patients almost always ignore, until it's too late to ignore any longer. Let's start with why this organ, so essential to survival, manages to fail so silently in the first place. Your kidneys are built like an incredibly sophisticated filtration system. Every single day, they process about 150 quarts of blood, pulling out toxins, extra water, and waste products, then sending clean, balanced blood back into your body. This happens through roughly 1 million tiny filtering units inside each kidney called nephrons. Here's the problem. Nephrons don't send out pain signals when they get damaged. There are no nerve endings inside them screaming for help. So when a nephron dies, whether from high blood pressure, diabetes, dehydration, certain medications, or simply years of wear and tear, your body doesn't flinch. It doesn't ache. It just quietly loses a small piece of its filtration power. One nephron dies, then another, then thousands more, and your remaining kidney tissue works harder to compensate, hiding the damage from you for months, sometimes years. This is precisely why kidney disease has earned its nickname among doctors, the silent epidemic. So why does almost everyone miss the signs? Because the early symptoms of kidney trouble look almost exactly like ordinary, everyday tiredness. Feeling a little more fatigued than usual. Needing to use the bathroom slightly more at night. Feeling puffier around the eyes in the morning. These are the kinds of things people blame on stress, poor sleep, getting older, or simply having a long week. There is also a psychological reason we miss it. Most people associate serious illness with dramatic pain. We expect a warning bell, a sharp stab, something impossible to ignore. But the kidneys don't work that way. They send whispers, not alarms. And whispers are incredibly easy to dismiss when you're busy living your life. But here's what makes this even more dangerous. Chronic kidney disease is closely linked to 2 of the most common health conditions in people over 45, high blood pressure and type 2 diabetes. If you have either of these conditions, your kidneys are already working under extra strain every single day, whether you feel it or not. There's another layer to this that rarely gets discussed. Kidney damage doesn't just happen to people who are already sick. It happens to people who consider themselves relatively healthy. People who go for walks. People who eat reasonably well. People who would tell you, with total confidence, "I feel fine." That confidence is precisely what makes this so dangerous, because feeling fine and being fine are not always the same thing when it comes to your kidneys. Age plays a role too. After the age of 40, kidney function naturally begins a slow, gradual decline, even in healthy individuals. This is a normal part of aging. But when that natural decline is combined with high blood pressure, diabetes, obesity, smoking, or a family history of kidney disease, the decline can accelerate far faster than most people realize, often without any noticeable symptoms along the way. Now let's talk about the actual signs your body may be sending you right now. The first warning sign is persistent fatigue that doesn't improve with rest. When kidneys begin struggling, waste products and toxins can build up in the bloodstream instead of being filtered out. This buildup can affect your brain and muscles, leaving you feeling drained even after a full night's sleep. It's a heavier, deeper tiredness than ordinary exhaustion, one that coffee and a good night's rest simply cannot fix. The second warning sign involves changes in urination. This might mean needing to urinate more frequently, especially at night, or noticing your urine has become foamy or darker than usual. Foamy urine can be a sign that protein, something that should stay in your blood, is leaking into your urine because the kidney's filters are damaged. Some people also notice the opposite pattern, urinating less than usual, which can signal that fluid is being trapped inside the body instead of being properly released. It's worth pausing here to understand why this happens on a biological level. Inside each nephron is a tiny structure called a glomerulus, essentially a microscopic sieve. When it's healthy, it holds onto large molecules like protein while letting waste and excess water pass through. When it becomes damaged, from years of high blood pressure pounding against those delicate blood vessels, or from elevated blood sugar slowly injuring them, the sieve develops gaps. Protein starts slipping through where it shouldn't, and that's exactly what creates the foam you might notice in the toilet bowl. The third sign is swelling, particularly around the ankles, feet, hands, or face. When kidneys aren't filtering properly, sodium and fluid can build up in your tissues instead of leaving your body. Many people notice this first as tight-fitting shoes or puffiness around the eyes that seems worse in the morning. The fourth sign is a change in skin, specifically dry, itchy skin that doesn't improve with lotion. This happens because healthy kidneys help balance minerals and remove waste from your blood. When that balance breaks down, mineral imbalances can trigger persistent itching that feels different from ordinary dry skin. The fifth sign is a metallic taste in the mouth, or a loss of appetite. As waste builds up in the blood, it can alter the way food tastes, sometimes creating a strange metallic flavor, and it can suppress hunger entirely. Many people quietly lose weight during this stage without realizing why. Now here comes warning sign number 6, the one doctors say patients ignore more than any other. Muscle cramps, especially in the legs, often at night. Most people blame this on dehydration or simply sleeping wrong. But when kidneys struggle to balance electrolytes like calcium, phosphorus, and potassium, muscles can cramp unpredictably, and it tends to happen repeatedly, often in the same muscle group, night after night. Because it feels so ordinary, so easy to explain away, this sign is dismissed constantly, even by people who are otherwise very attentive to their health. The seventh and final sign is trouble concentrating, sometimes described as brain fog, along with difficulty sleeping. When toxins build up in the bloodstream, they can affect the brain itself, making it harder to focus, harder to remember small details, and harder to fall or stay asleep, even when you feel exhausted. Individually, any one of these signs could mean almost nothing. A rough night, a stressful week, a dry winter. That's exactly why they're so easy to overlook. But when 2, 3, or more of these signs appear together and linger for weeks, they may be your kidneys trying to get your attention the only way they know how. Let me tell you about a man named Robert, whose story reflects thousands of similar cases doctors see every year. Robert was 62, active, and felt generally fine. He noticed he was more tired than usual, but he was working long hours, so he assumed that explained it. He noticed his ankles were a little swollen some evenings, but he was on his feet all day, so that seemed reasonable too. He noticed leg cramps at night, but chalked it up to getting older. It wasn't until a routine blood test, ordered for an unrelated reason, revealed that his kidney function had dropped significantly, that Robert learned the truth. His kidneys had been silently losing function for years. The individual signs he dismissed had actually been connected all along. Robert later described the moment his doctor showed him the lab results as one of the most frightening moments of his life, not because he was in pain, but because he realized how easily he could have missed it entirely. He kept thinking back to all those evenings he'd propped his swollen feet up on a pillow without a second thought. All those nights he'd woken up gripping his calf mid-cramp and simply gone back to sleep. Looking back, the signs had been there all along, quietly lining up, waiting for someone to notice. Fortunately, because it was caught before total failure, Robert was able to make changes that slowed the progression significantly. He adjusted his diet, worked closely with his doctor to manage his blood pressure more aggressively, and began monitoring his kidney function every few months instead of once a year. Not everyone is that fortunate. Many people don't discover the problem until dialysis becomes the only option, at which point the conversation shifts from prevention to management, a much harder and more limited place to be. This brings us to the biggest mistakes people make when it comes to kidney health. The first mistake is assuming that if something doesn't hurt, it isn't serious. As we've discussed, the the kidneys simply don't work that way. The second mistake is skipping regular checkups, especially for people managing blood pressure or blood sugar. A simple blood test measuring something called eGFR, along with a urine test checking for protein, can catch kidney trouble years before symptoms appear. These tests are inexpensive, quick, and can be requested at almost any routine physical. The third mistake is overusing certain pain relievers. Common over-the-counter medications, when used frequently or in high doses over long periods, can place extra strain on kidney function, particularly in older adults or those with existing kidney risk factors. This doesn't mean occasional use is dangerous, but it does mean it deserves a conversation with your doctor, especially if you take them regularly. The fourth mistake is not drinking enough water, or on the opposite end, not realizing that certain health conditions require water intake to be carefully managed rather than simply maximized. This is exactly why personalized medical guidance matters more than generic advice. There's a fifth mistake worth mentioning too, and it's a subtle one. Many people assume that because they don't have diabetes or high blood pressure, kidney disease simply isn't something they need to think about. But kidney disease can also develop from recurrent infections, certain autoimmune conditions, long-term dehydration, and even genetics. Believing you're automatically safe because you don't fit the most common risk profile can be its own quiet danger, the kind that keeps people from ever asking their doctor for that simple screening test in the first place. So what can actually help protect kidney health? Managing blood pressure and blood sugar is one of the most powerful things you can do, since these two factors place enormous daily strain on kidney filtration. Reducing sodium intake gives your kidneys less fluid retention work to do. Staying appropriately hydrated, based on your individual health needs, supports healthy filtration. Limiting processed foods high in phosphorus additives can ease the mineral balancing burden your kidneys carry. Certain supplements and herbal remedies marketed as kidney cleanses deserve a note of caution here as well. Some contain ingredients that can actually place additional strain on kidney function rather than protecting it. Before adding any supplement to your routine, especially if you already have a kidney-related risk factor, a conversation with your doctor or pharmacist is always worth the few extra minutes it takes. And perhaps most importantly, scheduling that simple annual blood and urine test can reveal problems while they're still manageable, long before symptoms like the ones we discussed ever appear. This test typically involves nothing more than a quick blood draw and a small urine sample, yet the information it provides can be more valuable than almost any other routine screening available to someone over the age of 45. Small daily habits matter more than most people realize. A short walk after meals can help regulate blood sugar. Choosing fresh, whole foods over heavily processed ones reduces the sodium and chemical load your kidneys must filter. Reading nutrition labels for hidden sodium and phosphates, ingredients hidden in things like deli meats, canned soups, and dark colas, can make a meaningful difference over months and years. Sleep matters more than most people expect as well. During deep sleep, the body regulates blood pressure and repairs itself in ways that directly support kidney function. Consistently poor sleep has been linked in research to a faster decline in kidney health over time, which means that guarding your rest isn't just about feeling alert the next day. It's about protecting an organ working behind the scenes while you sleep. Movement, too, plays a quiet but meaningful role. You don't need intense exercise. Regular, moderate movement like walking, gardening, or swimming helps maintain healthy blood pressure and blood sugar levels, both of which directly ease the burden placed on kidney filtration. None of these changes require dramatic life overhauls. They simply require awareness, the very thing this video is designed to give you. Here is the final secret, the one that ties everything together. Kidney disease is one of the very few serious illnesses where early detection can genuinely change the entire outcome. Unlike some conditions where damage is discovered only after it's irreversible, kidney function decline, when caught early, can often be slowed, sometimes dramatically, through lifestyle changes and medical management. The organ that suffers in silence is also, remarkably, one of the most responsive to early action. That's the paradox at the heart of this whole story. The very quality that makes kidney disease so dangerous, its silence, is also what makes awareness so powerful. You don't need fear. You don't need panic. You simply need attention, the kind of attention that notices when tiredness lingers too long, when ankles stay swollen too many evenings in a row, when cramps keep returning night after night. If anything you've heard today sounds familiar, if two or more of these signs have been quietly present in your life, don't brush them aside the way so many people, including Robert, once did. A simple conversation with your doctor and a basic blood test could be the difference between catching a silent problem early and discovering it only after the damage is done. Your kidneys have been working for you every single moment of your life, without complaint, without applause, without asking for anything in return. Today, all they're asking is that you finally listen.